When a patient has a need, my goal is to always fulfill it. Whether it is needing a new primary care physician or needing to obtain insurance, with teamwork and integrity, I always meet the needs of the patient to provide them with high quality care and respect.
I've strived to maintain Fenway's mission, especially throughout the pandemic, by assuring that my patients have access to quality, compassionate, and supportive care despite the barriers that they may be facing.
As part of the security team, we ensure the protection of all staff and patients and secure all clinical properties on site on a day-to-day basis. During the pandemic, security and staff, we became like a joint force, effectively communicating and maintaining COVID-19 guidelines.
It was important for me to let our patients know that although 3/4 of the country was shut down and the roads were empty, that our clinic was not closed. Our doors were always open. Our phone lines were always open. Whatever they needed, they can still feel free to reach out to us and we'd be there for them.
In my role, patients depend on me for triage, patient education, support, and care coordination, which we do by telehealth, phone, or email, whichever is most accessible to the patient to assure that their healthcare needs are met.
We also offer 2 evening clinics to accommodate hours. We also provide access to interpreting services as well as behavioral health services. And then on site, you will also find a pharmacy, a Quest lab, as well as dental services.
I strive to carry out the mission of our health center by continuing to stand behind our mission to be compassionate and empathetic to the patients that I serve, even through the most difficult and challenging times throughout the pandemic. Being flexible is also key when working in healthcare.
We do our best to accommodate patients with their needs. For an example, providing wheelchairs, and also for those who have clinical concerns or there's a language barrier, we try to direct them to the appropriate staff and or services that can provide them with the best answer they need.
I want patients to feel like when they're coming to see us, they're going to their favorite cousin's house, and there's going to be someone there to hold their hand with them during procedures and make them laugh, make them smile, and not feel as though it's the end of the world, even if they do get a bad diagnosis, that they're not alone.
Whatever the barrier may be, we are here to help them overcome them.